important to understand why exactly tachycardia. Why exactly it produces tachycardia? Now let's say, for example, what exactly does it do? Let's say this is what is a heart. This is what is the superior vena cava and inferior vena cava. This is the right atrium, the right ventricle, left atrium, left ventricle. We are trying to understand in this particular phase of the lecture that why nitrates, or I can say any vasodilator, produces increase in the heart rate. Don't try to buy heart things. I always say, if you buy heart things, it becomes very difficult to understand it and to apply this particular knowledge. So when it produces vasodilatation dilates all vessels. If you remember, it dilates arteries as well as veins. So imagine veins all over body are also dilated. So let's say superior vena cava and inferior vena cava. Veins are all dilated. So what will happen to the blood returning to the heart? Blood returning to the heart will be reduced. If the blood returning to the heart will be reduced, what will happen to blood going as an output from the heart? It will also be reduced. So what exactly happens that because of vasodilatation, patient is going to have blood returning to the heart reduced. So blood coming out of the heart, or I can say ventricle, per beat will be reduced. I'm trying to make you understand. I'm not asking you to buy heart things. Remember, this is very, very important. So blood returning to the heart is reduced. Blood coming out of the heart per beat is reduced. This is what is called as a stroke volume. So left ventricle से per beat में जो blood निकल रहा है, stroke volume has reduced. Remember physiology. When the stroke volume has reduced, what is going to happen to the heart rate? Because cardiac output has to be made constant. So if the stroke volume has reduced, stroke volume into heart rate is cardiac output. The stroke volume has reduced, heart rate has to go up. Physiology. To maintain the cardiac output. Because cardiac output क्या है? 1 minute में पूरे बॉडी को